Hi, I'm Emily Belser, and this is Brad Cohen. We're with the University of Georgia. In collaboration with the Georgia DNR as well as the DMRG, we're taking a statewide survey of cranial abscesses. Each of you will be receiving a bag with your private land labeled, as well as a code for your private land that will correspond with the name of your land. You'll also be receiving a data sheet. On each data sheet, please put the appropriate information where it's needed, such as sex, weight, age, and there's also a space for other comments so you can make comments about the deer's overall health. You'll also be receiving laminated directions, a bag with markers and extra bags and swabs, a bag of bags to place your samples at the end of the night, a bag with abscess kits, as well as bags for individual does and bucks. And now Brad's going to explain to you how to swab the deer, how to check for a cranial abscess, and how to swab for a cranial abscess.
Now I'm going to show you what's in each of the bags labeled buck and doe. Each bag contains a number of kits that are going to be used to sample for the prevalence of a bacteria along the deer's nose, tongue, and forehead. It's going to be done on both bucks and does, and we've given you the correct number of samples for each of the kits that will be needed. In the kit will be 3 sterile swabs and 3 vials that you can just dump out. The vials have different colored tops, red, white, and blue. Each one will be used for a different part, to swab a different part of the deer. First, we're going to take all 3 vials, and with a Sharpie, we're going to write the location code, which we give you on your bag. In this case, let's say we're Cooper's Creek, which is CK. And you're going to write the number of the deer that this coordinates to for the data sheet that you're given. To start your swabbing, you're just going to tear open one of these sterile swabs, lift it out. For the mouth, you're going to get into the tongue area and swab the tongue as hard as you can. Take it out, open the vial. Place this swab about 3/4 of the way in, pull down, and it should snap pretty easily. Okay, we're going to tighten that and put it off to the side for now. Next, we're going to swab the nose. For inside the nose, we're going to use the white capped vial, and we're going to go in and we're going to try and swab as far deep into the nasal cavity as we can. You should push up until you feel it give way into a deeper cavity. You're going to swab as far as you can, pull it out, and do the same thing. Open that vial, put that swab about 3/4 of the way in, pop it, and it should break. Cap it again, and we're off to the third one. Lastly, we're going to swab the deer's forehead. For bucks, we'll be swabbing around the pedicle area of the antlers. For does, you're going to be swabbing in a similar location, just where the antlers would be. And for this, we're going to use the blue cap. Okay, so we're just going to take some swab, being careful where we swab this deer, just swab around the antlers and the forehead, keeping in mind that we don't want to be as sterile about it as possible. Okay, once we're done, we've capped it, we're going to take out all 3 vials, we're going to put them back in the bag, and we're going to put on the bag, we're going to put the location code and the deer number, so this was CK3, and we're going to date it. And so that's what each one should look like when it's done. We're going to seal it up. At the end of the night, at the end of each date, basically what you're going to do is take bags that we've given you, you're going to put all your samples, you can be as rough now on these bags as you need to be, and stuff them inside one of these bags that we give you. And basically you're going to take them, throw them in the freezer, and just write the date on them when you're done, okay, and throw those in the freezer. Next, I'm going to show you how to inspect for a cranial abscess. This is every person at a check-in station is going to be doing this, and there's an associated spot on your data sheet called CA, and with that you'll be writing a yes or a no after you're done inspecting. And basically the inspection just goes, you're just going to look along the pedicle line, look for any signs that would indicate an infection, such as scabbing, necrosis of the skin, any pus. You know, the cranial abscess looks very differently at different stages. So even the most beginning phase where it's just a little bit of scab is still considered an abscess. So we're just going to push our finger along some of the lines, being careful not to actually touch in along the pedicle, because if there is an abscess, we're going to want to swab there, and we need it to stay sterile. And after we're done pushing along, if we see signs of a cranial abscess, what we're going to do is we've given you a number of abscess kits, and basically you're just going to open one of them. In each kit is 2 vials, an index card, and 2 swabs. First thing we're going to do is take that index card out, and we're going to write the deer's number and the location code and the date. What we're going to do now is, if you have a camera available, you're just going to go real close to the infection, put the card there, and take 3 different pictures at different angles of the infection. This is going to help us better characterize the infection. Also, try on the back end of the index card, write down anything that might be interesting about this deer, health-wise, such as weight, external parasite count, any signs of obvious malnutrition. And like I said, that's going to help us understand what these infections are doing to the deer. Now, once we're done with that, we're actually going to start swabbing. So we're going to take those 2 sterile tips out. We're going to take these 2 vials out, each with a yellow cap. Each vial, you're going to label again the deer number and the date. When you're swabbing for an abscess, we're going to want you to get as deep into the infection with the swab as possible. So you're going to open the swab and basically get as deep into the infection as you can, trying to get as much pus as possible. Roll it around a little bit. Open one of the vials. Do the same thing as before, 3/4 way, and try and snap it off. Okay, you're going to do that again, repeating the same thing you just did, so that we have repetition in this. Basically, you're going to get into that infection again, do the same thing, swab around any part of the scab, any part of the pus. You're going to put it back in this vial and snap it off. Okay, now you're going to take that bag the kit came in. You're going to do the same thing as before with the swabs. You're going to do location, the deer number, and the date. Put the 2 vials back in. And you're going to put that with the bag that we gave you to actually put your samples in. So these now can be put together. Now, keep in mind that any time you see a cranial abscess, it's not recommended that the people eat the deer, and it's not recommended that you freeze this near your food. So keep that in mind when you're placing these in the freezer. At the end of the season, one of your regional biologists will come around to pick all the samples up.